Welcome, everybody. It's great to be back with you. Since COVID started, this is actually the 21st of these webinars that we have done, talking to you with each time we do this with just really an incredible panel each time, and today is no exception. We have three of New Hampshire's top business leaders joining us today. Here live, and then a good friend of mine, Dan Burke from the West Coast, will talk to us about a great story from Pacific Dental. So very excited to kick this off today. If you're looking on screen, you're probably seeing that Chris Keith is actually not here yet. He will join us in a little bit and just jump right into it. He's an old pro at this, as you guys know. So let me begin, if I could, by just quickly introducing each of our panelists, and then we'll kick this off with my friend Paul Mckeon here in a few minutes. So let me just sort of set the table for all of you here. COVID has been, an unprecedented challenge for everybody, personally, professionally, just sort of at every level. And I was talking to Chris Keith about this a few weeks ago, and we were sort of reflecting on the lessons that we personally have learned, whether it's resiliency or flexibility or overcoming a challenge, and maybe that makes us more confident for the next challenge, and sort of reflected on, well, what have other businesses been through? What have they learned? And so we wanted to wrap up. We thought it was fitting to sort of wrap up 2020 with an update and talk to some top business leaders about what their experience was. Okay, and so that's what we're going to do today. Let me introduce you first to Paul Mckeon. Based in Portsmouth, New Hampshire, Paul is the CEO of a great company, B2W Software. Paul founded B2W, and his visionary leadership has driven continuous cutting-edge product development and revenue growth. With an extensive background in the construction industry, Paul plays a major role in shaping a responsive, client-driven product roadmap. He also mentors the sales organization on the solution-based selling model. Paul and his wife, Jessica, have 5 daughters, and in their spare time, they enjoy boating, golfing, travel, arts, and music. They're also major philanthropists in the Seacoast region. And I don't suggest playing golf against Paul because you're just going to lose a ton of money. Maybe that's just me. Let me introduce you to Tom Boucher, who probably needs no introduction to our audience. Tom is a very well-known leader in the food and beverage industry. He's currently the CEO of Great New Hampshire Restaurants. He graduated from the Merrimack College with a bachelor's degree in 1987. He actually earned a full academic scholarship to attend Villanova University, but forwent this opportunity because of his love for the restaurant industry. Over several decades, he's worked his way up to become CEO of Great New Hampshire Restaurants, which includes household names in New Hampshire, T-Bones, Cactus Jacks, and of course, Carpador. There are now 2 Carpadors, both very popular, one in Bedford, New Hampshire, and one, of course, in Salem, which is Eric Spofford's neck of the woods. Tom's vision is to become the premier restaurant company in New Hampshire for guests and employees alike. And I'd submit to you that he's achieved that goal already. Eric Spofford is the CEO of Granite Recovery Centers. Eric is an expert in the fields of addiction treatment and recovery. Born in Salem, New Hampshire, Eric himself has been in recovery for 14 years. No small feat. Congratulations, Eric. He first started Granite Recovery Centers in 2008. When he opened the very first recovery center, the Granite House in Derry, New Hampshire. His organization has now expanded and operates 4 treatment centers, offering a full continuum of care. Eric is also a published author. You can read his full story, but just got to Google him. But if you want to read the real story, he has a book that's available on Amazon, Real People, Real Recovery, and I highly recommend that you read that book. It's really an inspiring story. And, just thinking about tens of thousands of people whose lives have changed and have recovered from addiction thanks to Eric and his team. Eric has made numerous press appearances. He's testified before the United States Senate. He's been in the Boston Globe, the Boston Herald, WMUR, Union Leader, and continues to be a prominent leader and advocate for substance abuse treatment and recovery. And then our last panelist you can't see on screen right now, but you'll catch him at the tail end of the program, is Dan Burke. Dan is the Chief Enterprise Strategy Officer and also General Counsel at Pacific Dental Services, which is based on the West Coast. His current responsibilities at PDS include oversight of enterprise strategy and revenue. They have a very large legal team, legislative affairs, compliance. So Dan is a busy guy. They are an entrepreneur-founded and led company, just like the three companies of our other three panelists. You'll hear from him that at one point, they were scheduled to be a $2 billion company, which every one of us, of course, aspires to be prior to COVID. Dan's been recognized as one of the top 10 innovative in-house lawyers in the state of California and General Counsel of the Year by the Orange County Business Journal. He also received the 7 SEALs Award from the United States Department of Defense for his leadership and support of those serving in America's National Guard and Reserve. All right, so that sort of sets the table. Let's jump right into this, and I'll kick this off by bringing Paul Mckeon from B2W into the floor here. So, Paul, talk a little bit about. Let's go back to January, February of 2020. COVID hasn't hit yet. We have an inkling that it's coming. Talk a little bit about. Just tell us a little bit about what B2W does, and what life kind of looked like for B2W in January, February of 2020.
Sure. Well, thank you, Phil. I appreciate your time and effort today and the Nixon Peabody team, and also I want to thank Eric, Tom, and Dan, who will join us, I'm sure, shortly. So B2W has been in business for about 30 years. We service the heavy civil construction industry. We have about 2,500 customers throughout North America, and our customers are companies like locally Pike Industries, Brock's Industries, Continental Paving, Severino Trucking, so larger heavy civil construction companies. And we build and provide to them an operations platform that allows them to essentially automate 5 or 6 different areas of their business, 5 or 6 different workflows that range from estimating and bidding, field data capture of job cost information on a daily basis, scheduling, logistics, dispatching, equipment maintenance and repair, management of safety, and that type of thing. So we have been at it for quite some time. In the past 8 years prior to COVID, we have been going through somewhere between 22 and 25% growth on an annual basis. So we have really been booming, and things were going very, very well. We actually happened to be in Vegas the beginning of March at, first of all, our annual user conference. And we have 600 or 700 customers that join us there. And just after that, we were attending a large construction show, which is called ConExpo. And that was when there was kind of the first sign of trouble. There had obviously been some word, some information on the virus. It was unclear what was going to happen and what was going on. But we noticed that all of a sudden, several large equipment providers, Caterpillar, Komatsu, and others, had decided to back out of that show. That, for us, is a big show. It takes place every 3 years. There are some 130,000 companies that come to that. It's usually a great opportunity for us to showcase our software and to meet with CEOs, CFOs, and management teams face-to-face. So that was kind of the first sign that there was going to be some trouble. And, things obviously continued to get, I think, more uncertain. I think our team became more fearful. We had the mandate to stay home, work from home, shelter in place.
Right.
And it was a very, very uncertain time. It was unclear what was going to happen. March of 2020, our sales were 50% of what they were the previous year, and we had expected to be on another path for growth in the 20 to 25% range. So that was obviously very concerning to us. And as we moved on, I think you really had to think about how are we going to manage through this. It was still unclear what sales would look like. Fortunately for us, the heavy civil construction space was deemed to be essential, which included us. But we couldn't have folks work in the office. Our sales had slowed down. There was a lot of fear in our customer base around what this was all going to mean. Were they going to shut down construction projects, et cetera, et cetera. So the impact was over the March, April, May period. I think our staff, our teams were experiencing a lot of, anxiety, fear. It was very uncertain what was going to happen. I think there was a lot of uncertainty or fear in our team, as there have been in many, that there might be layoffs, there might be pay cuts, furloughs, and so forth. So it was a very, very difficult and uncertain and scary time.
Thanks for sort of setting that table, Paul. So now things just continue to progress, right, in COVID. Talk about lessons that you and your management team learned, right, as you sort of navigated through it now.
Sure. Well, I think at the end of the day, the most important thing in going through a process like that is to effectively communicate with the team. So first off, every Friday morning, I would send an email to the entire company, and I would kind of set the stage for trying to extinguish some of the fear and anxiety around layoffs. Fortunately for us, even in the absence of PPP, I was certain that we would weather the storm. So I was trying to reassure people that things were going to be okay, that ultimately the mandatory stay-at-home was going to go away, things would be better in the summer, better times ahead. But I think the key lesson for me was to really make sure that on a regular basis you're communicating with the team, and you're, to the highest degree possible, trying to set a positive tone around where are we going to go and how are we going to get there. I think another lesson that companies, us for sure, where you have an environment or a company where you can have a work-from-home model, you need to make sure that you have an infrastructure in place that will support that. We fortunately did. Interestingly enough, we just had invested in the end of last year a massive overhaul of all of our servers and our ability to manage the business. We happen to have a team in Europe that connects to our office and writes code every day as well. So we made that investment, and that really helped us, I think, provide an environment where people could effectively work from home. I do think, too, a lesson to be learned from this, and hopefully this will be the last event of its type in our lifetime, is, at the end of the day, liquidity is a key component to survival. And, you need to make sure that you focus on liquidity and you have money available in the event that there is some type of an issue. Certainly COVID was exceptional, but I think that's a big factor and a big contributing, element in weathering that storm.
So, Paul, had your teams used Zoom, for example, or WebEx or one of those platforms before in your work? Was that any part of what you guys were doing pre-COVID?
It was, particularly in the sales and to some degree in the training and implementation part of our business. We have been using WebEx, GoToMeeting. We had been doing some Zoom, but Zoom for us certainly wasn't as popular as it's now become. We had just rolled out Microsoft Teams as another tool to have our collective teams be able to communicate and work together. So we were well positioned, I think, in terms of our familiarity with the technology and the infrastructure to be able to work effectively through the crisis. Yeah,
that's good to hear. So now talk a little bit about 2021. What does that look like in your industry, for your business, and lessons that you've learned? How do you sort of carry that forward in 2021?
Sure. Well, interestingly, in 2020, we actually grew the business in terms of the size of the team. So we actually increased the size of our team by about 10%. And we did that because although things were difficult, I think fortunately for us, we'll probably end up flat over last year. But there's tremendous pent-up demand for heavy civil infrastructure projects. There's been all kinds of threats, obviously, in the last couple of years around an infrastructure bill that I think we will see that, I think, in 2021 as a stimulus from the government. But I am very optimistic. We're planning on significant growth. We've increased the size of the team. I think between, the vaccine with Pfizer and the others that are shortly to follow, I'm hoping and thinking we'll get to the spring and have 70 or 80 million people vaccinated, and the kind of herd immunity process can continue on its way. I do think we'll get to next summer and be back to some level of sanity. So my business, I think, will grow significantly. We've planned for it. We're excited about it. And I think that for us, at least, things should be very, very good in 2020. I certainly have great concern for the restaurant industry. I live in Portsmouth. Portsmouth is a big tourist area. We've seen shutdowns of several of the restaurants here, and I fear if there's another shutdown here, it'll get much, much worse.
Yeah, well, maybe you can convince Tom to open a Copper Door, in Portsmouth. So, but we'll take that conversation offline. But terrific. So, Paul, thank you for sharing your story with us today and the lessons. I really appreciate it. We are going to pivot over to Tom here in a minute. I see that my partner and colleague, Chris Keefe, has joined us. Chris, good to see you live.
Good afternoon, everyone. Sorry to be late joining.
Yeah, no problem. So, Chris, I'll kick us off here with
Sure.
Tom Boucher. Tom, nobody wants to be in the industry that was probably hardest hit by COVID, but somebody has to be. And, I think we're going to hear from you, but my guess is, and you're very humble, great management teams, shine in the most adversity, and I suspect that's the case with you and your team. But take us back to pre-COVID. We're going to ask you the same questions we asked Paul, and tell us a little bit about what your business looked like in January, February, pre-COVID, and what you were sort of planning on for 2020, and then we'll talk a little bit about what actually happened.
Sure. Thank you, Phil, and thanks to Nixon Peabody for having me. I've done a number of these over the past few months, and I think it's been pretty eye-opening for a lot of people. They know the restaurant industry is suffering, but when they hear the real numbers, they're shocked. So let me take you back to January, February. We were humming along. January, February were blockbuster months for us. We were way up in revenue and hoping for a record year, including opening our 6th T-Bones in Concord, was slated to open in late April, early May. Fast forward to, and we also had just purchased about a year ago, or now it's been, I lose track of time, it's been almost close to 2 years, we had purchased the old Shorty's in Bedford, across from Primary Bank, in hopes of turning that into a family-friendly kitchen and sports bar. And as you well know, it's sitting there dark, and it's going to sit there dark for a while. So fast forward to March 16th, actually March 14th, I had called my partner Mark and said, "Hey Mark, I look at revenue every single day for every one of our restaurants." And I said, "Mark, something's up. We're trending down 20% this week." I said, "There's just something. I think it's this COVID thing." And so I called an emergency meeting on Monday with our leadership team at 4:00, and we're all assembling in the 20 West at Copper Door. And my partner, Bill Greiner, I invited him just because of the severity of the situation. I wanted him aware. And he came walking in at 4:15 and said he just got off the phone with the governor, and they're shutting us down at midnight. I mean, you can imagine the looks on all of our faces. I literally ripped up the agenda and said, "Okay, we have a completely new agenda now. What are we doing?" Imagine just having the rug completely pulled out from you. And I'm not pointing fingers at the governor by any means. He's done a terrific job, but it was devastating. And sitting there in my chair, they're all looking at me for answers, and I clearly didn't have any answers right off the cuff. We worked into the night, and 9:44, I still have it logged in my head, 9:44 at night, I logged into our Staff Matters group page, which is a private Facebook group page that our employees are engaged in, and I had to lay off all but 100 employees. So we laid off 600 employees, and kept 100 of the management staff and office staff, and we proceeded to just operate with takeout only. And that went on for weeks. I actually worked in the kitchen at Copper Door for a couple of weeks, and given my age of 55, it was very challenging for me. It brought me back to my roots, I'll tell you that. But, you know, I was worried. I had many sleepless nights. I cried many nights, not knowing where are we going to go. We were bleeding $100,000 a week. And, you know, we don't have cash reserves to last us a year at that pace. So we fortunately, so during that period, we were down 80% in revenue, which is just ridiculous. And when the PPP monies came through in mid-April, I felt a relief and thought, we're going to be okay come the summer. And we spent the money as appropriated. We were supposed to spend it over 8 weeks, keep your employees employed, which we did. We paid every single full-time employee to stay home, and we brought some of them back because we needed the extra help. And then through the summer, we got to the outdoor dining was allowed to be open, and thankfully we were able to put tents up. The weather, unfortunately for the farmers, was terrible, but it was terrific for outdoor dining. So we had a very dry summer. So we had a great summer. All through September, we actually did the same or more revenue, and profitability was up. So we were in good shape. I felt really good going into the fourth quarter. In fact, I had booked a trip to Florida. I was supposed to be with Phil this weekend going to the Patriots game. And I guess I was feeling that optimistic. And then bang, you know, with the spike happening and the losing the outdoor dining, our revenue now is back down anywhere from 30 to 40% down, and we're back. I don't know if we're breaking even right now. It's, you know, we don't do weekly P&Ls. We do, but they're not full blown P&Ls. We don't get them until about a week after the month end. So yeah, we're right back where we were in March. You know, losing money probably, and we're working hard and advocating for another round of PPP.
Tom, just to follow up on that, you know, what are some of the other things you can do to adapt? I mean, obviously you had to make hard decisions with respect to your workforce, and, you know, what are the other ways in which just operationally you had to make changes?
Yeah, so it's funny, when Phil asked me to come on here, I said I'd be happy to. This is one of 4 pages that I wrote down of things that we've done and had to do to change and measure and recreate and measure and recreate and measure. You know, we did start doing curbside. It was good, but we measured it. It was less than 5% of our total revenue and only about 15% of takeout. But the labor expense and the complication it involves was just not worth it. So we tried it, we measured it, we took it away. We've had to, you know, you talk about all this technology. We didn't have Zoom. You know, we're a face-to-face company. We meet with our managers face-to-face. We meet with our employees face-to-face. You know, there's no office time other than our office personnel. They're not sitting behind a computer. So I had to quickly figure out, how am I going to communicate besides our Facebook page with all of our managers? You know, we've got 100 managers that I need to communicate quickly because some of the stuff was moving lightning fast. So we figured out Zoom. That was a quick learning curve for some of our managers. A lot of them are not tech savvy. We started Slack, which has been a terrific tool for us to communicate very quickly. And again, some of this stuff comes at us so unbelievably quick. If you look at the state guidelines of what we have to follow, it would make your head spin. We've created our own flow charts, very complicated flow charts to determine what to do if an employee is exposed, showing symptoms, or test positive. It's incredibly complicated. You know, the whole 10 minutes for 6 feet or less, or 6 feet or less for 10 minutes or more. And then you got to quarantine them. We had to close Salem Copper Door for 5 days because we had so many employees quarantined. We couldn't even staff at the appropriate level. And I think that's what you're seeing a lot when these restaurants are closing temporarily. That's exactly what's happening to them. They just don't have the staff. Some of the other things, one thing that we did, which has been, again, I really ramped this up very quickly. We started a delivery what we call a ghost kitchen. They're very popular in the big cities. They become even more popular due to this. And what it is you create an off-site kitchen facility where the rents are extremely affordable, rather than trying to pay the rents like at Copper Door in Bedford. The rents are huge. I mean, we pay them to ourselves, but nonetheless, it's still an expense to the restaurant. So we already had our commissary in the inner city of Manchester producing all of our cuts of beef and desserts, and we do a lot of fresh prep and deliver with our fleet of refrigerated vans. So we created our own ghost kitchen called dingdongdeliver.com, where you can order meal kits that are delivered to either your Bedford home or your Manchester home, or to one of our other restaurants that you can pick up. Things like chicken pot pie or shepherd's pie, things that are time-consuming to make at home, but they're fresh and they're T-bones or Copper Door quality. Well, much to my surprise, we did some meal kits for Thanksgiving, and now for Christmas, we're over to 500 orders and $50,000, which is revenue that never existed for us. And so that's been a pleasant surprise and something that we ramped up real hard. I had always had a vision of doing something like that, but COVID kind of pushed it a little faster than we anticipated. Some of the other things that we've done to help mitigate people's fears is we've installed MEVA 13 air filters, which are the best grade that you can get to filter out the air. We've purchased air purifiers that eliminate 99.97% of viruses, including COVID, and each of our locations has multiple units in each of the buildings. So, including all the normal safety measures that we do. We've got sanitizer for customers, we've got employees washing hands, we've got our kitchen employees wearing masks, which is not mandated. So we've done a lot. We've tried really hard to communicate to the general public that it is safe to eat in restaurants, and that the media is spreading false information. I've asked the state of New Hampshire multiple times, as has the state association, show us the data that shows that people are getting COVID from a restaurant employee. It's simply not true, and they can't provide the data, and it's wrong. And for whatever reason, they're singling us out. I get it, because people are dining together, but for the most part, if they're dining together, they likely have been around each other already. They're likely a family coming out. And, it's not like there's four strangers sitting at a table for an hour and a half. So those are some of the things that we've done to try and really make customers feel comfortable that dining inside is safe. And, I'll just say one other thing too, that again I think is a really misunderstood data point for the general public, is that, well, why can't you just do more takeout and delivery? You're not going to survive on takeout and delivery. You're just not. 80% of our current revenue right now is indoor dining. The rest is takeout, and in some cases 85%. And you can't make the numbers work at that volume. Delivery services take anywhere from 25 to 30% of your ticket. Restaurants don't make 10%. So any restaurant that you see, an independent that's doing Grubhub, DoorDash, or any of those, they're actually losing money every single time they take an order. And I don't understand why they're doing it, but they are. And I just think it's a mistake. They haven't done the math, I guess. Digital menus, we did that very early on. We did online ordering. Both those things never existed before COVID. We have, like I said, I've got pages of things that we've never had to do prior to this. So running restaurants was challenging in itself, and then you add on all these pages to it. It's been the most challenging 9 months of my life, my team's life, and I'm very blessed and fortunate to have a team around me that collectively, the 7 of us on our leadership team, have over 400 years of experience in the industry, all with great New Hampshire restaurants. So we each have our own specialty. We trust each other and we lean on each other, and it's brought us really close together, to be honest with you. We've had very, very few conflicts and just have worked really well together.
Thank you for sharing that with us. I mean, 2020, obviously, hopefully you never have a year as tough as 2020. Of course, we're still in a second wave right now. It's going to take quite a long time for these vaccines to really make a difference and so forth. tell us a little bit about what you see for 2021 and how you guys are prepared to address this.
Yeah, so I think, I try and do as much reading as I can. I'm very close to the National Restaurant Association. I've spoken with them at length. I've got a number of consultants that I have access to that are in the field of looking down the road. And everything that I've read, they kind of put the industries in different segments. Segment 1 is you're going to have a fast recovery, 2, mediocre, 3, et cetera. Everything that I've read, we're in the category 1 area where we're going to have a fast recovery. Not in Q1, Q2 a little bit, but Q3 and Q4 should be very strong. There's going to be so much pent-up demand. I mean, I'm sure everybody on this call right now has eaten out far less than they used to. And I'm sure you would love to get back out to eat and enjoy the atmosphere and the hospitality and the employees. So the pent-up demand is going to be tremendous. And I think by the third quarter, everything that I'm reading is we'll be close to 2019 numbers, which I'm optimistic about. We just need to weather. And I think, as Paul pointed out, it's going to be a lean winter, and we've got to get to the spring, and we need that bridge from the federal government to get us there, or you're going to see a lot of restaurants not get to that Q3 recovery. Long term, I'm optimistic. We're going to make it, but I can't. I've used this line a number of times. My crystal ball has been back ordered from Amazon for the 4th time. And I'm patiently waiting for it.
That's right behind your patio heater, right?
Yeah, right.
Yeah, well, send us a crystal ball when you get it, okay?
You got it.
Chris, you want to pivot to Eric, and we'll go from there.
Terrific, yeah. Eric, let's bring you into the conversation. So in the very beginning of the year, how did you and your business look headed into 2020?
The business was lively. It was active. We had enormous plans for growth. We were set to grow by more than 30% this year. We were existing at about a total bed count, meaning client beds, at about 300 with plans to get to 400, all of which we did accomplish, and some really, throughout the year. But overall, the addiction crisis, the opioid epidemic, alcohol use, et cetera, had been pretty consistent over the last 5 years. And so it was busy. It was moving forward well and smooth.
And did you notice any disruption when sort of March rolled around?
Yeah, I remember. I think we all have our moment of the first time COVID kind of hit us and showed up. And I was actually at a luncheon with the leadership team for Elliott Hospital, having some discussions with them, when one of the doctors that was in the meeting got the phone call from Dartmouth, which was the first COVID patient in New Hampshire. And I remember it was kind of this ominous moment of like, oh wow, this is now here. Client 1 is here. And so as, we started to prepare for that and had our internal conversations, there was just so much uncertainty for all of us. It was very difficult to plan for. But as the shutdowns happened, and the increased pressure and stress on people started to apply, and the uncertainty and the anxiety, we started to become overrun with people that were seeking our services. We were lucky enough in the beginning of the year, and actually for most of the year, to not have to interact directly with the virus. I spent most of the year knocking on wood every time I would even talk about it, because we were very blessed for the most part with not having many or any at all staff members getting sick or testing positive, as well as clients. But the demand for services for inpatient and outpatient addiction and mental health treatment just took off like something we'd never seen before. Couple that with, having to take all the precautions for COVID. Similar to the restaurant business, we're a face-to-face business. There's an administrative, back office component that supports the operations, but these services, for the most part, aside from telehealth, which telehealth certainly is not going to replace in-person services, is face-to-face, especially in our withdrawal management, our inpatient detox programs, and our inpatient residential treatment programs. And so we had to start to prepare with, the beginning, getting PPE, getting masks was very difficult, and faced a lot of those challenges.
And so, Eric, eventually, you did start to see COVID creep into at least one of your centers, right? But along the way, I think you were dealing with staff that were getting sick, right, and having to manage through that. Talk about some of the lessons you've learned in dealing sort of head on with the virus.
Yeah, absolutely. For most of the year, I agree with Paul certainly about transparency being key and positivity. And a high level of communication, but I've learned more about COVID in the last 60 days than I have all year. We had, one person here and one person there that was exposed or would test positive, and they were quarantined as staff throughout the year, but it really wasn't a large problem. And so from the very beginning, the language I was using around this was this is a when, not an if. That this is when COVID shows up. And what we had was probably several months ago now, a month and a half, close to 2 months, we had our first client become positive in the treatment center. Came in and was actually removed by law enforcement halfway through his treatment stay for an outstanding warrant, brought to a jail that had a COVID outbreak, and then brought back to our facility. And that was client one for us. And, in this facility, we have mandatory masks, social distancing to the best of our ability, hand washing, house cleaning, doing absolutely everything that we had available to us and doing all the things that we've been told to do. CDC and Department of Health and Human Services guidelines, following them to a T, daily execution, and all that. And we got a lot of respect for this disease going into it, but even more respect watching it firsthand. And we watched that one person, that one case turn into 90. And about 30 of those people were symptomatic. And generally, most of those people had very light symptoms. They said it was cold-like symptoms. They were sick for 2, 3, 4 days and got better. Just a small couple of them got what I would call, significantly sicker, but all are well. And, when it came in, that facility has 170 staff members and 160 clients in a mixture of residential and outpatient services. And so we mass tested everybody. And so and over the course of 2 days, with the help of the National Guard, or not the help, but the supplies of the National Guard originally, gave PCR tests to more than 300 people. And what we saw when that came back was, we had 30 people that were symptomatic that we were, pretty positive that these folks had contracted COVID-19. But there was another 60 that were asymptomatic. And so people that were positive with the virus but exhibiting no symptoms, and according to the science, possibly contagious. And so the lessons, we spent a couple weeks. I don't think any of us on the leadership team or the boots on the ground slept. We had at one point 50 staff members quarantining, which provided, and, we don't have the option to shut down. We're a 24-hour, 365 business providing treatment services that, if we weren't here and available to admit and treat these clients, their outcomes would be less than favorable. We see a lot of people suffer severe consequences as a result of their addictions. And so, staying mission focused and staying the course, because that's the reality of the clients we serve, was incredibly important. Doing so with that many staff members out at one time was very challenging. I, like many organizations, incredibly blessed with an amazing team that stepped up. I mean, we had folks that were sleeping at the facility. They were working 18-hour days, getting 6 hours of sleep, and getting up, taking a shower, and getting back after it to make sure that we had coverage to continue providing the treatment services.
So Eric, obviously, demand for addiction treatment and the services that you provide is sadly not going anywhere in our society, and we had sort of the experience in 2020 of the pandemic sort of really overshadowing some of the other issues we face as a society. Hopefully that the air, at least with respect to COVID, starts to clear as we go into 2021. What do you and your team sort of see ahead for your business as we roll into the new year?
Great question. One of the things, what we ended up on with this is, it was over the weekend after we had been 2 weeks into this outbreak and everyone was sleep deprived and trying to figure our way through the other side of it. And it came to me late at night and I said, the way we're thinking about it at the time, I think was wrong. And what that was we're going to isolate the positives and let them quarantine, participate in telehealth, and we made all these accommodations with the end goal being a COVID-free addiction treatment program, that we got back to baseline, no COVID cases. And, with this recent surge, it just hit me. I said, I don't think that's realistic. I don't think that we can continue to provide treatment services. I mean, we have 400 beds today. Right now we have probably more than 350 people in treatment in 24-hour care. They sleep in our beds. They eat our food. They receive clinical treatment somewhere. How can we keep up that volume of taking in, probably 400 admissions a month in the middle of a COVID surge, and operate in a manner without COVID? It hit me and I was like, this is impossible. And so we took the lemons and we made lemonade, and we fully turned it on a dime. I got with the leadership team that Monday morning and said, we need to turn this thing around, and we need to be able to operationalize how do we run this business and how do we continue to provide, the life-saving services that we do with COVID present. And this is something that, we're going to have to get comfortable with being uncomfortable with. And we opened a full continuum of care for folks that are testing positive, either symptomatic and medically stable or asymptomatic that are testing COVID positive. And so now I believe, to the best of my knowledge, and I've asked and I've looked coast to coast, I don't know of another addiction treatment provider that has specifically pivoted and opened a COVID-19 positive treatment unit. And because the other thing that was happening is you're having folks that were ending up in other facilities. Part of the information that drove this was they would present with COVID-19 and the facility would discharge them. And so an example of that is, you have a 25-year-old heroin addict that comes in and is even asymptomatic or symptomatic for COVID-19. The chances are they're going to be fine with COVID-19, but you turn them around and after they lifted up a pretty heavy phone to call for help, and the family's sitting at home with a high level of anxiety, hoping that they, this is the time that works and they find recovery and get their loved one back, and they would have to turn them away and put them out on the street. And so now not only are we isolating new cases that come in, so we have direct admits and we quarantine them in their bedroom. We give them a antigen test when they arrive and a PCR test when they arrive. The antigen test is rapid result and tests for the presence of the virus currently. The PCR test is more delayed. It needs to get shipped out to a lab. It takes about 72 hours for us to get back with the lab we work with. And that's considered the gold standard, the most accurate form of testing. And then depending on whether they test positive or negative, that's whatever unit we admit them to. And thank God, in the last week, with the admissions just in the last 7 days that we've completed our testing on, we've had 3 people come in off the street to come into treatment that tested positive for COVID-19. And so it ended up being somewhat of a blessing in disguise of, waiting for the shoe to drop, and then finally it did. The when happened. We've operationalized it. We've normalized it. We've, gotten the team motivated and inspired and continued to guide them back to the mission of how important this work is and what we do. And we're just one foot in front of the other, working our way through it.
Eric, great job on that. It just sort of, another example of what a great entrepreneur you are and taking a really bad situation, and coming up with something new and innovative. And Tom's probably listening to this thinking, like, can I open a COVID-19 restaurant? COVID-19 is going, and he's thinking about it. So
Yeah.
I don't know if it translates into the restaurant industry or not, but I would go if Tom opened that restaurant. But thank you, Eric. Really great stuff. So we're going to turn to Dan Burke now and hear from Pacific Dental. So bear with us here for a second. Today is Dan Burke. Dan is an old friend of mine. We go back a long way, and Dan, it's really great to have you here representing Pacific Dental, an incredible company. And maybe the place to start, Dan, is tell us about Pacific Dental and what you guys do, and maybe what things look like for you when it's not a COVID year.
Sure, happy to do it. And thanks for having me, Phil. Good to see you, my friend. So Pacific Dental Services is what's called a dental support organization. It's basically a large group practice in dental. And it's a growing business model where in dentistry, about 80%, maybe 75% of all dentists are solo owned by just the dentist. And, they have a small staff and they're independent of anything. And then we have these groups, of which Pacific Dental is one of them, which are basically aggregating. And there's different models to it, but it's happening rather quickly. So to give you a sense of Pacific Dental Services, in that space, we're not a nationally branded, so you wouldn't have heard of a Pacific Dental Services practice, even if there's one in your neighborhood. They're locally branded with the owner doc's, owner dentist's name on the door, not ours. And right now we have about 820 of them. And there's about 3 of us that are the 3 largest. We're all about the same size, to give you a sense. And to give you a sense of magnitude, pre-COVID, we had budgeted 2020 to end the year at about $2 billion in aggregated revenue, which in our space makes us pretty big. Compared to the dental spend in the US, that's about 1.5%. So there's still a lot more room to grow. That's why there's so much activity in our space, as you'd expect. What's also unique about us in our space is we're still founder-led. So Steve Thorne, who you've met, Steve, founded the company about 26 years ago, and he's still the CEO, and we've never taken PE money, VC money, anything outside of us. It's all grown organically, which is pretty remarkable. And in our space, and Aspen, for example, is a company for those of a lot of your businesses and clients might be in the New England, New York area, might know Aspen. Other ones, Heartland. They're in the space. For us, a lot of our peers also grow by acquisition, as you'd expect in an aggregation play. Ours is not that. It's all what we call in our industry de novo. So it's all organic growth. So we only grow when an owner dentist has an associate dentist who works for them, and that associate's ready to go out and own their own practice. If they like what we do and it helps them be the dentist they want, they'll say, hey, help me open a practice. And we'll go out, we'll buy dirt, we'll build the building if we can, and we take care of everything for them, all the software, computer systems, all the non-clinical employees, that's all us. So we have about 14,000 team members now, to give you a sense of that. And yeah, that's Pacific Dental. And it's comprehensive oral health care under one roof. So all the specialty come into it. So in a neighborhood, a patient might go in and be pretty surprised that there's a general practicing dentist. There might be a board certified pediatric dentist, an orthodontist, an endodontist, periodontist, and oral surgeon will come in. So just to give you a sense, that's Pacific Dental.
Yeah, great background, Dan. Thank you for that. And it's a very impressive story, right? Sure. What Steve and your team and everybody has done there. So there's an old adage, that, anybody can manage in good times, but only good managers can manage in bad times. And 2020, obviously, right? What a challenging year for everybody with COVID and so forth. So for in the Northeast, it still really started for us in March when things started to lock down. But tell us what you experienced, and as the management team sort of going through it, how you pivoted, and sort of persevered through it, and the lessons that you learned that you could share with us.
Sure. It was as dramatic as one could possibly imagine. We're across the country. We're in 21 states now, and COVID hit dentistry, and it's been there's a number of stories that have been written on how drastic it was. So we went, as we came out of Q1, we were in Q1 in March, we were very much exceeding our expectations, on pace to do $2 billion in aggregated revenue, the whole bit. To give you a sense of pace of growth, we only passed $1 billion 4.5 years ago. So that's how fast we're growing. That's the energy in our company. And when COVID hit, it was basically overnight a light switch was hit, and dentistry was almost completely shut down. We did, I think, relative to our peers and others, I think we were the leader, and our business only dropped 85% overnight. So overnight, we were looking at busting our bank covenants. We were looking at full-on shutdown across the country. Nationally, word went out, as we all remember, and everything was focused in healthcare on medical, as one would expect. And it was immediately focused on emergency departments, getting that PPE, the personal protective equipment, rationing it. What are we all going to do? When shutdown orders came out from the different governors, everyone that came out forgot dental. So basically, it was, in a way, it was shut down and was included in emergency only, which most dentists felt that they weren't ready to see. They didn't feel that they were outfitted for what that would mean. What does it mean to practice dentistry in a pandemic? And so for most, nearly all, I can say, in dentistry, the answer was turn off the lights. At best, put out a phone number, a place where patients could reach a dentist in an emergency, and a dentist could talk them through whether they should go to the emergency department or not. PDS and our supported dentists reacted differently. So quite literally, when this is one of those case studies, when everyone goes left and you go right, first you have to say, did I just turn down a one-way street the wrong direction because everyone's going the other way? So you have to question yourself. But we went the other way, and we've been asked, and I've been asked why. And for me, it's a really easy answer, was that Pacific Dental Services, and then of course all our owner dentists, and there's well over 600 owner dentists. The vast majority only own their own practice, one practice. A few own more, they're entrepreneurial, but give you a sense of how large that community is. Our supported dentists view themselves as critically important to systemic health. That's one of the places where PDS is leading, and that's saying the maladies of the mouth, they absolutely impact the rest of the body. Now, it may be that you have periodontal disease, and that could be an indicator that if you're pre-diabetic, hey, wait a minute, something may be triggering right now. You may be having inflammation in other places, but it can also be causative. The bugs in the mouth do travel through the saliva and the blood to the rest of the body, and it's been connected to diabetes, dementia, pregnancy, low birth weight. It's been connected to so many conditions in the body. And that's something that is just commonly understood in many places, but certainly in the Pacific Dental Services environment. So when COVID hit, when it was like, oh my gosh, look what's happening, that our dentists actually said to us, we need to stay open. And we need to stay open for two reasons. First reason was we need to be open for our patients for dental emergencies. And we also need to be open for our patients who have systemic conditions such that if they don't continue to seek their treatment, it will exacerbate other conditions and could lead to a very serious condition event. So they said we need to be open for our patients. And the other thing they said, and we said this as a community quite loudly, was we need to help preserve the precious capacity of emergency departments and urgent care centers. Because we know, and we've already known this, that the number two reason that certain demographics, including I think it's 20 to 34, I think it's the number two reason why that age group goes into an emergency department, an ER, is for a dental emergency. We know that every 14 seconds in the United States, someone goes into an ER with a dental emergency. And think about the choking impact that has. ERs have to admit them, they have to do an exam, they have to see them, but they don't have dentists by and large, and they don't have dental facilities. So, and they have to use all their PPE on that patient as they would. And that's the last place also, if you think about it during COVID, that a patient wants to go if they know they're going there because if it's a mouth problem. They don't have COVID, the last place they want to go. So for those two reasons, our dentists said to us, and we said to them, do you want to stay open? And they said to us, we have to stay open. And that's the fundamental decision that we made. And then from that came, and I'm happy to share them with you, what were all the decisions and what's the type of headwinds we had to face in order to help them stay open in a pandemic in a way that was safe for them, compliance with the law, and safe for their patients. And that made all the difference for us.
Was there resistance to that decision? Was there internal resistance to it?
I would say yes, in that the dentists each make their own individual decision of whether the practice will stay open. And Ballparking, about 735 stayed open. So there was a good group of folks who said, you know what, for me, for whatever their own personal decision, and of course, what we all respect it, right? They said, my role isn't to stay open. You know, I'll do teledental, which we stood up, by the way, in 4 days.
Wow.
We'll do that, and I'll see my patients that way, but I won't physically go into the practice. And that's to be respected, of course. Internally, there wasn't resistance, I would say, because everybody believed in it. We all thought this is the right thing to do. The resistance that we found, we referred to them as hurricane headwinds, right? They were real. And it was, the first one was all those emergency orders from the governor's offices and the public health officials. They either forgot dental, so it was, oh, I guess we're closed, or what can we do? Or it was so restrictive, it were confusing that the dentists just didn't know what they could do. I'll give you a real example. In St. Louis, I spoke to a dentist because we were doing calls AM and PM twice a day. Myself, compliance, legal team, managing through all this. And we had a dentist in St. Louis, I believe it was St. Louis, who had a city health official who told them one thing they couldn't do. The county said something different. The governor's office had something different. And then he was trying to figure out what the heck is CDC saying and not saying, and what's coming out from the White House. So quite literally was paralyzed, saying, I'm getting conflicting advice. So we had to go after that first. And that, you know, it was, how do you even get heard in a hurricane, right? And so what we ended up doing was we came up with a social media campaign, and it was called #DentalER. And we tried to speak to public health officials through that, saying dental is here. It's part of your local public health system, and it's critically necessary that you allow them to stay open to see emergency and essential patients who need the work, because of the impact on the ERs if you don't. And I'll share, and I'll tell you, Phil, it was one of the single most successful things I've ever been a part of. It exploded. It got picked up in the medical world by the ER people themselves, who they started posting and celebrating, saying thank you. It got picked up by public health officials. We had the heads of public health associations actually taking our posts and forwarding them around, and we got 2 of them to actually do a webinar with us. I was actually quoted by a chief of staff of a governor back to me, my own words, about telling me why we needed to play an important role in their state by staying open. It was remarkable. And I will tell you, 50 for 50 in every state. Dental was seen as essential and was permitted to stay open, provided you had PPE and all the rest. But that was just one. Was first, we had to make sure that we could stay open. And then we had to, you know, as far as PPE goes, Phil, you probably heard the stories of, and that was real. Like it was a free for all. There was no national response as far as that goes, and that's not a criticism. That just is. So you had different states competing with states to buy masks and gowns and all the things that people need, and even down to gloves. Then you had different countries, different folks, all these entrepreneurs popping up who suddenly they had 100,000 masks, and one wondered, where did they come from? But we had to sift through all of that. And we had one story. This is like one of those where, you know, you hear these stories. We actually had to charter a plane and fly it to the middle of the country with PPE. And then we had to have our regional folks all drive from the different states at night, and just to pick up so they would have enough PPE and all the practices. It was that type of environment. It's that type of, you know, 24/7. How do you turn in a complete business model around? And
So these are all things you're doing, right, that you couldn't even have imagined back in January or February, right?
Yeah.
You'd be working like logistics of airplanes flying around, trying to get PPE. I had a similar experience because I was in the middle in the Northeast, helping the governor of New Hampshire and the National Guard fly over to China. En route, you know, the stuff is sitting at Beijing airport, and the Chinese government won't let them land. You know, we're on the phone with the State Department. And we're not sure if they're going to be able to land. Then picking the stuff up, paying 10x prices. Now it's on its way back, and we're hearing that the federal government's going to confiscate all that PPE when they land, because they want to reallocate it themselves, right? Back on the phone, right, with the State Department, trying to make sure that doesn't happen. So I totally get that, but it's crazy. It's doing stuff you wouldn't have guessed. You said teledental. How did that go, the teledental?
Sure, we're on a system called Ring Central. One of that's just how we use for our communication platform. And we realized immediately that our fundamental patient flow down at, literally office by office, patient by patient, we had to change everything. So we just talked it out loud. Like, for example, we all know what it's like to go to dental practice. You walk in and then there's a waiting area and all of that. Well, you can't do that anymore. You can't have a waiting area. So, and there was no blueprint because there was no other practices open. So we had to switch to say, okay, we've got to greet them in the parking lot. We got to go out in our PPE and we got to screen them out there. Because if they crossed the threshold back then, if you remember, if someone walked across your threshold and they had a temperature, everything was shut down.
Right.
So we had to change all that patient flow. And then we thought, okay, well, what about the patients at home? It's traditionally a phone call. We knew we had Ring Central, so we called up, got their most senior people and said, we need a solution. And literally 4 days later, we were, to my knowledge, the first to have a national teledental platform, to which Aetna, United, even 1-800-DENTIST, which is like a referral, we were their national dedicated teledental solution. So, and they said to us, you're only in 22 states, you got to find the other 28. So we had to scramble and find dentists that aren't affiliated with us or groups in the other 28 that we could get on the teledental platform with us. So go to Ring Central and say, I know they're not really with us, they're not in our contract, but you got to spread us out 50 states because Aetna and others need a 50-state solution for their members. So during COVID, we were the sole or primary referral service for a whole number of places who had members and that needed had emergencies or essential care they needed to find a dental practice that was open. So we stood up teledental and then we expanded it through 50 through call it a network, if you will, so that we could make sure that in 50 states members could be seen. So it was crazy, man. It
is crazy. It is crazy. So we've only got time for one more question here.
Sure.
So now, having been through all of this, right, scrambling, meeting the hurricane head on, if you will, how are you feeling about 2021 and what that might look like and the challenges that come with 2021? Or does it all seem easy now that you guys have been through this?
I'm afraid to say the word easy. I would say our community is incredibly resilient. Our values were really strong. We made a ton of value-based decisions. Like, we knew who we were when the crisis hit, so we didn't have to say, who are we? How should we react? We knew who we were, so we reacted. Right. So we go into 2021 with very high level of confidence. We're going to end up the year exceeding. Now we looked at what we would expected to do, right? But we reacted extremely well. Our banks were very, very happy with us. And we go into we'll end 2020 very strong on the bottom line. People have had to work too hard. It's been like a lot of businesses. As business really brought back, we had to figure out ways to get things done better and be more efficient. So I think we'll take those learnings into 2021. But we're very optimistic. We're turning on the growth engine again in 2021. We see a lot of greenfield ahead of us, candidly.
Great. No, that's great, Dan. That's great team, great leadership, great lessons. I really appreciate you taking some time to share those with us today. And it's great to see you on screen. Look forward to seeing you in person at some point.
Yeah, and I haven't had a chance to thank you through this. Jill has been tremendous out in your LA office. How do these regs impact dental practices, which were written for medical, and with all the PPP loans and all the navigating through that? Is just this morning I was on a conference call with the team. So thank you for all your team's help.
Our pleasure.
Appreciate
Happy to do it. Thank you, Dan.
All right, my friend.
Tom, Eric, and Paul, we want to thank you for being with us live today. We've come to the end of our program. Another great thought-provoking discussion, and in fact, our last one for 2020. So you are bringing us to a close in fine fashion with a lot to look forward to for 2021. We appreciate you being here with us today.
Great.
So in addition to this webinar series, we've been holding a variety of timely programs across a variety of issues and industries, and you can check them out on our website, nixonpeabody.com. You can also sign up for client alerts and see other white papers and other information there as well. We encourage you to check it out, and we will follow this up with a link so that you can get going on that. We wish everyone a very happy and healthy and safe holiday season. We look forward to seeing you again in 2021.